Hey, how's it going? So happy Veterans Day to all the veterans out there. Shout out to my brother Jeff, my brother Cedric, my dad out there, all of my brothers who served out there, even my close friends, all of y'all that served out there. Thank you for your service. All right, so this is a quick video about Medicare and the options for Medicare for anybody that may be in the VA. You may be turning 65 or you may be 65 and you may be thinking about the options of having VA care and Medicare. So there are some options out there for you. And a lot of them can work in your benefit. So I'm going to give you four options. We're going to discuss the options that you have, some pros and cons that are with it, but just to kind of clear up the confusion. So as you're going to your VA or you're talking to your agent, if you're in a different state or anything like that, you can know your options and then move forward with a great decision. All right, so here's just some things to know. So if you have VA benefits, you're still eligible for Medicare at 65. You can enroll in both. It's smart to do that. But you don't have to drop your VA care. So please do not drop your VA care. Most veterans actually use both, and they use VA as the primary and Medicare as the backup. So VA is number one, Medicare backup. It pays for anything after. And so that leads us into our next point, the coordination of benefits. Make sure that this is coordinated correctly, that your VA care usually pays first and then Medicare pays second. And that's for any care outside of the VA. The VA is only going to cover the services at the VA facilities. So just understand how the two work together. So if you have Medicare, and you have doctors in your network, you're traveling somewhere, doctors in the network, wherever you're traveling, other than the VA, that's where Medicare can come in and cover those costs for anything that's outside. Cost consideration. So like I said in the video before, you have Part A, which I look at that like it's room and board. It's usually free. You have Part B, which is your outpatient care, and a premium comes with that. So understand when you do add Medicare that you are going to be paying a premium for Part B, and Part A is usually going to be free. Part D is a premium is going to be with that one as well. But where the VA takes care of most of your drugs, but that Part D is a prescription drug plan or drug coverage, and that takes care of drugs that are outside of the VA that the VA doesn't cover. VA care is generally free and comprehensive for enrolled veterans. So I'm just going through all of these different points. The Medicare gives you flexibility to go outside of doctors that are outside of the VA. So just understand how that works. And many veterans choose both, using the VA as the primary, and like I said before, Medicare as the secondary to cover those costs. So let's jump right into option one. So these are for people that are only looking into VA care only. Who is this for if you only have VA care? So it's for veterans who are happy with the VA facilities, doctors, and a coverage. Some of the pros that are with that, is no premium with VA care. VA often covers prescriptions, hospital stays, and preventative care. And another pro is you have access to specialized VA services, the rehab, mental health, prosthetics, things of that nature. Here are the cons that come with it. You're limited to the VA facilities and doctors. You may have long wait times for appointments, long periods between those visits. And then you may have to travel. You may have to travel to a different town if you don't have a VA in the specific town where you're staying at. And so those are the pros and cons. Option two, these are for people that enroll in Medicare, parts A and B, and while they're still keeping their VA care. And so here are some of the pros with that. Part A, usually premium free, like I stated before, hospital coverage. Part B covers doctor visits, outpatient services, and preventative care outside of the VA. You can see non-VA providers if needed. That's what the Medicare covers. And then the Medicare can cover services that the VA doesn't, like some therapies, specialists, and things like that. So just look at it like that. Look at the Medicare when you add that as a supplement to your VA coverage. Here are some of the cons that go along with that. You have a monthly premium with Part B. You must manage care between the VA and Medicare. So like I was saying before, coordination of the benefits. That can be the most confusing thing, coordinating the benefits between your VA care and your Medicare to make sure that they work hand in hand. And then, some Medicare Advantage plans may not cover all of your VA services. Now, as we're getting down into option three, add the prescription drugs. And we're getting ready to run out of time. This is going to be a two-part video. So I'm going to sign off here, and we're going to start with option three.